Thanks, Dr. Escott. Up next, Dr. Hayden, if you have a moment, could you tell us what are you seeing there in the ICUs in Austin and Travis County?
Yeah, thank you for having me here today and giving me this platform to speak directly to our community. You know, I think I speak for all of our staff here in the ICU, the nurses, the respiratory therapists, PT, OT, social work. I mean, everybody who comes together to take care of the sickest COVID-19 patients in saying that we are tired. We are emotionally and physically tired. And seeing the projections that Dr. Escott just showed us is chilling to me. I feel like we are working basically at capacity. We are working hard, and the idea that numbers could increase exponentially is really daunting. I was involved with taking care of the first patient diagnosed with COVID-19 here in the Austin area back in the middle of March. And pretty much every single day since then, I have either taken care of COVID patients, mourned for COVID patients that we have lost, planned and prepared our hospital systems and ICUs, and worried about this nightmare scenario in which we truly are overwhelmed and unable to provide the usual excellent standard of care that we strive to give to everybody. Right now, I'm sitting in an empty patient room, and I sit here with sadness because the reason this room is empty is the patient who has been in here for the past 6 weeks fighting for her life, unfortunately, has passed away. And without violating her privacy, I'll say that this patient was actually someone who transferred to us from a town in West Texas because they were overwhelmed and had no ICU capacity to take care of her. And so at great risk to her own life, we put this unstable patient in a chopper and flew her hundreds of miles away from her family and support. And that's something that I don't want to see happening here in Austin. And as Dr. Escott said, since all of our surrounding metro regions are also in bad shape, there may be nowhere to transport anybody. And we may wind up in a position where we're having to use less experienced staff in makeshift rooms. And that's a nightmare none of us want to come to. But we do have the power to affect this trajectory and to slow the spread of this disease. And I would plead with everyone in our community to do the things that Judge Brown and Dr. Escott just mentioned, to stay home when you can, to wear a mask when you can't, to stay distanced from people, to wash your hands, to do everything we can to protect ourselves, our families, and our entire communities. You know, what we're seeing is like a house fire. I mean, the suffering, the magnitude of suffering in the ICU right now is like nothing I have experienced before, in that entire families are being ravaged at the same time by this disease. We've had so many instances where husband and wife, or multiple generations, father, son, siblings, are all in the hospital at the same time, and alone. You know, being a COVID patient is an experience I would wish upon nobody, in that there is a lot of suffering. People are short of breath, they're frightened, they're uncomfortable, they're on life support machines, and they're going through all of this by themselves because their family is often not allowed to visit for the protection of everybody involved. Sometimes their families are in other hospitals fighting for their own lives. And seeing these patients suffering and lonely is a hard thing, I think, for all of us who work here. And many, many times hearing from family members who think that they started that fire, that they were the one who potentially brought COVID home to their family, the guilt and grief in that belief. And most of the time, we'll never know for sure who brought it to whom. But I do know that those people will live with that guilt the rest of their lives, that their decision to attend that wedding or get dinner with a friend or grab that beer or whatever the decision may have been may have led to the severe suffering and death of their loved ones. I'm glad Dr. Escott brought up the fact that even very young people are being hospitalized. To the young people out there, your chances of surviving COVID-19 are really, really good, but there is still a chance you could have a hellish journey in the hospital before you recover that will change your life forever. And I'll say that the youngest patient that I have personally lost to COVID-19 was 25 years old. And that's not something I ever want to see again. And so I would really, put out a plea to the young people that a virtual holiday celebration is kind of lame, but a virtual funeral is heartbreak. And so to do what you can to, again, protect not only yourself, but your mom or somebody else's mom out there in the community who may not be able to withstand this disease.